Thank you again for joining us. My name is Lee Montville, Springer Publishing Company here in New York. I wanted to, before we move to Dawn Apgar's webinar, I just wanted to give everybody a heads up that if you're interested in purchasing any of Dawn Apgar's books, you can purchase them at springerpub.com. And then you can utilize the discount code APGAR25 to receive 25% off of all of Dawn's books. In addition, if you have any questions during the webinar today, please feel free to put them in the chat and Dawn will answer them either during the webinar or at the end. We will have Q&A at the end, so please feel free to ask any and all questions you have. And thanks again for joining us today. So without further ado, here is Dawn Apgar. Thanks, Dawn.
Thanks so much, Lee. So welcome everyone to Discovering Successful and Innovative Ways to Pass the Social Work Licensing Exams. As Lee said, this is a webinar, but I'm hoping it'll be interactive. So please, yes, please type in the chat. So I'm happy to see that people are already doing so. And I'm sure many of you have questions, which I definitely will get to. If I don't get to them today, I'll follow up with you directly. And what we're going to do, this is not a test prep course, but what we're going to be doing for the next hour is we're going to be talking about some of the systemic and individual challenges associated with passing the licensure exams. So I'll talk about some of the challenges that both schools experience and educators experience in preparing students for the exams. And I'll also talk a little bit about some of the challenges experienced by social work graduates. Then we're going to talk about strategies, right? That's why you're all here. You want to know what are some ways to get people ready for the exam, or what are some things that you can do yourself? And then lastly, we're going to talk about some of the books and the resources that I've developed, published by Springer. We'll talk about the print resources as well as the digital access. And one of my absolute favorite things, Exam Prep Connect, which is an online learning community. So you are not alone in this, and we'll talk about some of those resources. So you can see me, I can't see you, but I'm watching you through the chat. This is what I look like, right? And here's just a little bit about me. You can Google me if you want to, and you can see my faculty page. I've been in social work higher ed. I have to laugh. It says 20 years, but when I looked at the slide, I think it's more like 30. But I'll take 20. Full or part-time for the last 20 years. I'm actually a faculty member at Seton Hall University, and assistant chairperson of my department, which encompasses sociology, anthropology, social work, and criminal justice. Most of my professional career has actually been in practice. I know many of you are in practice. Feel free to type in the chat your areas of expertise. I've worked mostly with low-income families, providing emergency, transitional, and permanent housing. I have a long career working with individuals with developmental disabilities and their families. And I transitioned into research. I was the director of a research center for 14 years at the New Jersey Institute of Technology, and have been doing mostly policy work in the public sector for the last decade or two. You can see some of my leadership work. Most notably, I was the chair of my social work licensing board, and people will often ask me, how did I get into test prep? I really got into it because I was seeing that my colleagues were often struggling and looking for good test prep resources out there, and there really weren't. a lot of good test prep resources, and I had been doing a lot of work related to professional development and professional practice and ethics training. And so that's really what got me interested in test prep and giving back to my profession to make sure that people were ready for the licensing exams. So we're not doing a poll here, and I love seeing your areas of expertise in the chat. You can also feel free to indicate which of these categories best fits you. If you're like me, probably it's more than one. I'm sure we always have, and we always do when we do these webinars, lots of people who are taking the exams, and they're either just graduating, and maybe taking the baccalaureate or bachelor's exam or the master's exam, or maybe studying for the clinical or advanced generalist because they've been out in practice for a while. Some of you are either part-time or full-time educators, and you're interested maybe in learning more about how to get your students ready. Some of you are administrators or clinical supervisors, and you are mentoring people who are taking the exam. Some of you may be doing tutoring or doing test prep programs, either through your universities or privately. You may be employed by an entity that is doing test prep, or you may fall into the other category. So I see a lot of people in the chat saying that they're studying for the test, and so we'll certainly be giving you lots of great tips over the next hour. So we know, right, I feel like I'm sort of preaching here to the choir, because we know how important licensure prep and licensure is for social workers. We know that many people post-graduation are going into jobs that require them to be, I gave some data related to MSWs here, but the same holds true in undergraduate as well. We know that many people are graduating and wanting to enter jobs that require licensure, right? All states have some form of licensure, either at the clinical level or in other areas. We know that there are differentials in pay for jobs that require licensure and those that don't. So obviously, many social workers after they leave school are anxious to get ready, and this is a high stakes exam, and we'll be talking about that. One of the things that is also interesting, I just came back from the Council on Social Work Education conference this past week and weekend, and there's a new educational policy and accreditation standards that will be coming out in 2022. And one of the standards that is proposed is that social work programs are also going to not only need to assess the outcomes of their students, but they're also going to be needing to assess post-graduation outcomes. And so for those social work educators out there, one of the ways in which they are proposing that educational programs do this is by using licensure pass rates. So not only is this high stakes for students and graduates, but it soon will be high stakes for educational programs as they look at different measures to assess their post-graduation effectiveness. We also know that students, right, and graduates are very satisfied when their programs link their coursework, right, and their education to licensure. So many programs are incorporating licensure prep either into a capstone course or into a field course. And we know that programs that do this often get very high ratings from students, because who wants to be someone who's graduated and done well, but is now sitting alone, trying to get ready for a licensure test post-graduation. So really, licensure prep is important, both to the student and to the educational program. But we know that some people struggle, right? We know that there are some people who graduate thinking that they're going to have no difficulty on the exam. They were maybe an excellent student, and then they get out there and they find that for one reason or another, and we're going to talk about those reasons, that they're not able to pass the licensure exams. And the data indicates this, right? We're not going to talk about the associate's exam here. That's actually the bachelor's with a lower pass rate. But you can see for the bachelor's, the master's, the clinical, and the advanced generalist, the pass rates, these are first-time pass rates, but you'll see anywhere between 1 in 3 or 1 in 4 graduates doesn't pass the first time, okay? And obviously I'm following the chat and people are saying I'm testing, or I've taken it before, and that can be extremely discouraging. What I would say to those of you that there are many reasons for not passing, and we're going to talk about those today. That's the focus. But one thing that's really important is to figure out what difficulties and why that's happening. And there are certainly different reasons for that. So here are, I've framed this a little like a licensure question. There are really 4 main reasons that people have difficulty on the test. One is it takes time to get prepared. I always, I laugh because I say my house was never cleaner than when I was studying for the licensure exam. And we'll talk about each of these, so I'm not going to go into them, in depth in this slide, but it does take time out of your schedule to get ready. Just like the SATs or the GREs. And unfortunately, many people, graduate, or they may take the test in the last semester of their coursework. They're already overloaded with, school, class assignments and things like that. And there's many, social workers are very busy people. So we'll talk about that. Obviously nerves, people were talking about anxiety, right? And I'll talk a little bit about some of the, I always find the more you know about the test, right, and the more reputable information that you get, the better you feel, okay? So certainly staying calm is important. But the last 2 things I really think are the focus of a lot of the materials that I've written, and many of the things that we're going to be talking about today. You can be great at working with clients. You can be great at self-reflection, engaging with people. You can certainly be a wonderful social worker, but that doesn't mean that you're a great test taker. And so often people are not experienced with taking multiple choice tests. There are different kinds of questions. And so, and there are different strategies for each of those types. So we'll talk a little bit more about that. And then I was loving looking at your specializations, right? But we're each sort of specialists in certain areas, and these tests are generalist exams. So even, when we're talking about things like the clinical test, we're talking about direct practice in a very broad sense. And so often there are gap areas, and filling in those gaps are important. So what I want to do in the next half hour is I want to talk about each of these, okay, and some of the resources. So unfortunately, the one thing I can't do is add more hours to the day. Trust me, if I could do that, I would be doing that for myself. as well. But I'm very encouraged to see that many of you have test dates. I always say there's no better time than now to take the test. I find that people tend to formulate their study plan based upon their date. People will often ask me, how long should I study? I say, well, as long as you have, right? There's no, magic number. Usually what happens is people pick a date and then they develop a study plan to that particular date. Some states allow you to take some of the bachelor's or master's test before you graduate. Some do not. It depends on the state in which you're testing. But you need to understand your own, study schedule. Some of you will only be able to study on the weekends. Some of you will need to take a week off from work. You'll need to, and I'm looking at the date, you'll need to check with your state licensing board to see whether you're able to take it prior to graduation or not. It will depend, okay? And then even if you're able to take it prior to graduation, some states, as I said, allow it in the last semester, you may be too busy, quite frankly, with papers and other things. But the main thing is to get a date, and then we'll talk about developing a study date just developing a study plan to that particular date, okay? But don't procrastinate. Certainly, we see that the longer the gap between graduation and testing, the more anxious people feel. This is a test about what you've learned in your undergraduate and graduate programs. And so certainly you want to get that test over with, if you will, and you want to take it as close to graduation as possible. For those that are taking the clinical or advanced generalist, which requires supervised practice experience, for you, you want to take it as soon as you're eligible to take it as well. I always say I can't control the outcome, right? None of us can, we don't have a crystal ball. We can't control necessarily whether we pass or we don't pass, but what we can control is our study plan. So I don't really worry, and when I work with people, I don't fixate on passing. Passing will come. If your plan is good, your study strategy is good, you will pass. So I spend most of my time working with people to put together a study plan. And that study plan is really geared towards the content outline or the blueprint for the exams. And so I have all the books next to me, but all of the guides that I've written are based on those particular blueprints, as is Exam Prep Connect. And so I'm always puzzled when people come to me and have failed the test, and I'll say, well, what KSAs are you struggling with? Or tell me about, and they'll say, KSA, what do you mean? I don't know what that is. And I'm like, well, it's very difficult to pass if you don't understand the way in which the exam is structured. You're not familiar with the knowledge, skills, and ability statements, the competency, the overall framework. And so that's a lot of what my study materials are really is to educate you about that framework. So again, this isn't a full test prep. I'm looking at the chat or whatever, but if you don't know what KSA is, you're going to need to know that, okay? Because that's really the way in which the exam, it's the knowledge, skills, and ability statements. Understanding those, they're different for each test, is critically important, okay? And then obviously breaking up the study material. The good news is that, when you look at the guides, they're very comprehensive, but a lot of this material, someone told me this is an MSW in a book or a BSW in a book. So a lot of the material is material that you have learned once, but you may need to, kind of refresh your memory on. Okay. So developing a sort of study plan that's reasonable, right, and is not cramming at the last minute. I find that people make a plan and work the plan is really important. Okay. The other thing I'm going to talk about the Exam Prep Connect resources in a minute. I'm a big fan of studying off of written materials, and that is written meaning either paper or online written materials. I have worked with many people who are using a lot of videos and audios, and then they have difficulty on the real test. This is a reading test. The reality is you need to be familiar with keywords. You need to build up your stamina. And so I always recommend preparing in the same way that you're going to be tested. Okay, so I have lots and lots of tips. Some I won't be able to get into them all today, but I'm dressed, I'm sitting at my computer, I don't have lots of food and things like that. I really mirror my study conditions to the way in which I'm going to be testing. Okay, because of that, all right, because I'm used to, let's say, studying off a computer, or I'm used to reading those kinds of things. I actually, one of my tips is I actually had a study outfit when I was studying. So I had sort of my study uniform. I would get up, I would, somebody saying they're studying in a mask, absolutely. But I would, again, mirror those conditions. I was pretty calm, actually, when I took the test. These are high stakes exams, but if you put together a comprehensive plan and you use the resources that are available to you, you should do quite well. I have to laugh because I find that people spend more time collecting test prep resources than they actually do using them. Okay, don't be one of those. Don't be one of those people. That will just be feeding your anxiety. One of the free resources that's available to you on the ASWB website, you can take an online kind of free tour of the testing site. Getting familiar with the conditions is important. A lot of times people are not familiar with them, and then they get there and they're shocked that they have to lock everything up. They can't bring their water bottles. They can't chew gum. They check their glasses. Think airport security. So if you can anticipate these kinds of things, you will be more knowledgeable about them, and they won't be a surprise to you. So you can take a virtual tour. Some people were posting in the chat that they're retesting. One of my tips sometimes is to go to a new location, not because the test is different, but because, going back to the same spot. I've had people sit at the same computer that they tested at before, and you want a new outcome. So you're using a new strategy, you're using new techniques, hopefully, the next time that you test. And so going to a new location can represent that. I agree. Some people are saying going away from home is more effective. When I was writing the guides, the library was very familiar with me, because I would get up every day and I would show up at the library, and I would, you have to know your own, your own comfort. But again, you need to think about managing that stress. I always find the more stressed I am, the more structured I am. So you'll see right next to me, I have a very detailed list, right, of things that I need to get done, right? Because I have a lot of things I'm juggling. And so I would encourage you to write your plan down, or better yet, use Exam Prep Connect, which we're going to talk about in a minute, but they will, Exam Prep Connect will put a plan together for you, okay, which can be helpful. The other thing I would say is be kind to yourself. I've had people who have said, I'm just trying to think, just things to themselves that we wouldn't say to clients. So when people are telling me they're studying 8 hours a day, I say that's too much, right? At some point, you're not effective. You might be studying 3 hours a day, right? The exam is 4 hours, it's 170 questions. So you obviously need to build, build up your stamina, but no one can, if I can get in 3 to 4 hours of writing a day, I'm feeling great. No one can write for 8 hours. No one can study for 8 hours. There's some great resources. I put Springer Pub's website. There's a web page for some testimonials and some other resources related to the guides. And you can see a little fact sheet that we've put together about the exam as well. So the more you can become familiar, and I think hopefully today you'll learn something new that will hopefully alleviate some of your stress. I could give hours and hours of, this is what I do, right? So I could talk for a very long time about breaking down the questions. And unfortunately, that's not really what this webinar is about. But I do just want to say that your study strategy needs to consist of content, right? And we're going to talk about that in a second, but also becoming familiar with the structure of multiple choice questions. So this actual clip is out of one of the guides. It's actually a clip right out of one of our resources that helps you learn about the different parts of a multiple choice question. So things like the background, the STEM, qualifying words, right? So I'm looking here, it's literally clipped right out of the practice test guide. So you need to understand the way in which different kinds of questions are formatted, and then also answers. There are, the right answer is what we call the key. The incorrect answers are called distractors. And so these are, there are, I never use the word secrets or, but there are certainly strategies to help you understand what the question is asking and which KSA you need to focus in on. And so test preparation materials will help with those, okay, with those. There are different kinds of questions: recall, application, and reasoning. And again, this is material that is covered in the guides. Recall are those, you don't really have to memorize anything, but you do need to remember certainly information that you learned in your undergraduate and graduate social work program. And so, for example, they might ask, which of the following is the best definition of active listening? And so there are, best is a qualifying word, but you do need to understand what active listening is and what are the sort of key components. That would be a good example of a recall. Some of the tests ask you to apply the information. So you not only have to remember it, but you have to use it in a very straightforward manner. Okay, usually in application questions, the KSA, the knowledge, skills, and ability statement is evident. You know what it's being asked, but you need to apply it to a particular vignette or scenario. So they might give you a scenario and say, which of the following defense mechanisms is this an example of, okay? Again, it's about defense mechanisms, but you have to be able to pick out based on the client's behavior which one of those it is. And then the last type are our reasoning. Those are critical thinking questions. Many times the KSA is not evident. They'll ask you, what should a social worker do? And a lot of that doesn't mean that you don't. I've heard people say you can't study for the test, or you don't need to study. I don't agree with that. You certainly do, but you do need to take that understanding of key concepts and then use it to reason through 3 response choices. And depending on what exam you're taking, exams like the clinical or advanced generalist focus more on reasoning. The master's test is probably a combination of all 3. And if you're testing at the bachelor's level, you're going to have more recall and application. Okay, so, but you do need to understand, and there are strategies for looking at the formats and how to study material in a way that can make you successful. This again is out of one of the guides, but this is just an example of 3 different, this is the same material. It's asking about psychotropic medications, but it's asking it in 3 different formats. And so it's asking which is a mood stabilizer. We know that mood stabilizers are used for bipolar, and then it's in the reasoning format, not giving you the diagnosis, but giving you the sort of the signs, the symptoms of bipolar, mania, and depression, and you have to pick out. So the answer is the same. You can feel free to type into the chat, since I'm doing most of the talking here, if you want to interact. I love interaction. So here, yeah, so the answer is the same regardless of the format, but it just shows you how a KSA, right, of psychotropic and non-psychotropic medication can be asked in 3 different ways, okay? And so as I said before, if you were taking the clinical exam, chances are it would look like and use the reasoning format. If you were taking the bachelor's, it would look more like the recall, and then the master's would probably look more like the application, okay? So one way, all of and people are asking in the questions, I'll get to those in a second, about the different guides, but yes, you need to make sure that you are using the right study materials. Somebody is, so one of the unique things about the books that I've written and Springer has published is that they are unique to the exam that you're taking. So you want to make sure you need to check with your licensing board, because the master's and the clinical exam are the most common exams that are used in each state. Every state uses the clinical exam. Most states use the master's. The bachelor's is used in quite a few states. The advanced generalist exam is used in far fewer states. So that's a state-specific question. That's not for me. But one of the things that you need to make sure is that you're using a resource for the exam that you are taking, okay? Because there are 4 different exams, and the content outline is different for each, okay? And so for those of you that wanted to get more experience looking at the different kinds of questions that I just went over, not only do we have the guides for each exam, we also have a full-length practice test, which contains those recall and those application and reasoning questions. So, which are another 170 question full-length exam. A lot of times people not only want the content, but they also want access to those practice questions to see those different kinds of formats, and to get practice sort of breaking those down. Okay, so each of our guides has those for purchase. So the last thing is the content, okay? And we just talked about how important it is to get the right guide, okay, and use materials. That's really important. I'm looking at the chat and trying to concentrate on the slides at the same time. One of the things that often people are surprised about, regardless of whether they're taking the bachelor's, master's, clinical, or advanced generalist, is often people are surprised at that meso and macro content. So this is a social work exam. Even if you're taking the clinical exam, this is social work, right? We need to be able to practice the competencies at all three and use all three practice methods. Okay, you have that generalist year plus your specialized year if you're, you have an MSW. And so you certainly are going to have questions on, let's say, social planning, social action. You may have questions about service delivery. You may have questions about working within, with funders and things like that. And so I often find that people sort of overstudy the clinical content, especially, they're sort of hyper focused on the DSM, and then they get to the test and they're like, oh my gosh, I had no idea that they were going to ask me, I'm just about genetic counseling, or they were going to be asking about sexual dysfunction. There aren't any surprises on the test. Each of the guides outlines the KSAs. And so again, shouldn't be any surprises because yes, for some tests, there certainly are lots of meso and macro KSAs. And also clinical practice doesn't just mean the DSM. So we know that over 80% of people focus in on those micro practice areas, but that doesn't mean that you're not going to be tested on those meso and macro as well. Okay, so I always say that people usually spend about 80% of their time focused in on studying about 20% of the content. And people are asking, how much time do I need to spend in the chat? Well, I can't answer that because I don't know what you know. All right, you can answer that. Once you look at the study materials and you're familiar with the KSAs, you will know which areas you have adequate knowledge in and what areas you don't have adequate knowledge in. And then you need to fill in those gaps and need to allow time for that. So you're actually better able to answer that question, but you certainly need to have ample time to look over the KSAs, right? And to figure out what do I know and what don't I know. Okay, and obviously, if you're an expert in the DSM or you work in mental health, I'm just looking outpatient and you're working with the DSM every day, that's not an area that you're going to need to study in. Okay, but there may be some other KSAs that you're less familiar with. Okay, that you're less familiar with. So let's talk about, people are asking about the various editions and the online resources. I'm seeing lots of questions about those. So I had posted before, and maybe Lee, you can direct people to the website in the chat, but so that people can become familiar with where to look at the guides and understand the difference between the guides, and you'll see lots of testimonials and other things there as well. So yes, I'm super excited about the third editions of the guides. I love when people ask, what are the differences? I always laugh because I'm like, well, I think I probably spent a summer in my pajamas writing are there differences? Of course there are differences, right? In some cases, 100 pages different. So it would be impossible to go over every change and every difference. And I think on the website there are some the test taking tips have been expanded. There's been content that has been expanded related to things like sexual orientation, gender expression, obviously diversity, ethics. So you can look online and there'll be a sort of high level overview, okay, of some of the distinct differences. But one of the things that I'm super excited about is that all of the print guides, and I know we also have EPC, we have digital access to the books as well, but all of the print books come with 6 months free digital access to EPC, Exam Prep Connect, or you can just sign up for 6 months access to EPC. I call that an online learning community. And so that's one of the kind of the big differences. And I want to just outline some of the features of EPC. One of them is that it can create an online study plan for you. And I'm going to show you the screen in a second, but when you log on, you can enter your test date. And it can be a real or even a anticipated test date. And it will chunk up all of the content into sort of bite-sized pieces, if you will, or I call it like a Fitbit, because it will tell you what you need to do, let's say every day, to be able to get through the material. So it develops an individual study plan for you, which you can follow or not. I've stopped wearing my Fitbit during the pandemic because I'm a little depressed at how many steps I'm taking. But people find it as a really easy way, because you log on and it'll say, this is how many points you need to get. This is what you need to do today. So EPC does that for you. And you'll see here, this was, I didn't want to risk internet and connectivity, so I took some screenshots, but here, you know, I had taken a screenshot. I have 73 days to study, so it gives me points, and it tells me how many points I need to earn here. Okay, so yes, if you you get 6 months free, or if you buy the book, or if you purchase 6 months, and you can certainly extend your access or purchase additional time if needed. And I'm sure the people from Springer will let you know how to do that. Okay, so that's great. It's also fun because sometimes when I just need a pick me up, I hit the little coffee cup. The Springer people are probably laughing. It has little like TikToks and memes and little videos. So it gives you little ways to take study breaks and smile and, you know, add some levity as well. Okay. So if you purchase the book new from the publisher, you will get a access code that comes into the code in the book, which is good for one person. Okay. It's individualized access for 6 months from the time that you redeem the code. So yes, that will happen. So that's great. The other thing is, I call it an online learning community, and it's one of the great features is that it has a both a public and private discussion board. So I'd love to see in the chat if anyone is online and using it and has the 3rd edition and is using EPC. I'd love for you to post because they can attest that every day people are posting on the discussion board, and they're using the same book, and EPC, they're using the same product, yay, that you're using. And so I'm not going to use your name because I know this is being recorded, but have you seen me there? Have you seen me on the discussion board? I post all the time. So I'm there with you, right, in spirit, as well as if you post and you say, I read this and I don't understand this, or I you know, need additional resources or whatever, yay, I'll be there. So I'm probably the most frequent poster, but you can also develop private discussion boards with other people, like your peers who may be going to the same school or the same agency. And so you have the ability to do that, okay? And people will study people will share lots of tips, and I certainly will share my tips as well. So yes, it is a community, which is great because many of you may be alone in your studying. And so I will be there, as will others. So these are just some examples. People will, again, this is just a screenshot, but you'll see posts every day. I sometimes will post questions. This is somebody was posting, related to New Jersey. They'll post all kinds of things. Okay, so that's a great resource. And here, if you want to develop a private group, you can invite people, coworkers, supervisees. It's a great way if you are in an agency setting to use it as well. Okay, as I said, the guides have not only tips, but they also have content. So whether you're using the print resource or you're using Exam Prep Connect or both, I think most people kind of like both. They buy the book, they like to have the hardcover, for reference, but they, on their day-to-day studying, will use Exam Prep Connect. It's really important that you do have a material, you do use a resource like ours that have both. I have lots and lots of people who purchase a lot of just like tips and strategies, but they don't use a comprehensive product that goes over the content. So yeah, they're updated. Literally, they're always updated. I'm just looking at the materials are updated. People are asking about tutors or whatever. If you're using, I guess if you're using Exam Prep Connect, in some ways you're getting a little bit of me as a tutor, in the sense that I and other people are always there providing tips and strategies as well. Okay, so it is important that you're looking at both. Okay, and obviously we have a different site. This is actually, we get this a lot. There is a different EPC site for each of the guides, okay, and for each of the practice tests. So for those of you that are using, let's say, both the guide and the practice test, you would actually have access to two different sites. And you would have access to the electronic resources that are available for that particular product, two different discussion boards, and they work together. Okay, they work together. So there is a different site for each of the products. And if you've, some people have saying, I use the masters and now I'm studying for the clinical exam, you will be getting access when you buy the book or you buy EPC to a completely different, a completely different site. Okay, each site and each book is tailored to that. The other thing is, the great thing about EPC, the book is great, but I'm a big fan of using the digital resources as well, is that it comes with a game center. I talked about the discussion board, but it also comes with flashcards and other things like that you can interact with. Again, I could spend an hour just demoing EPC. And some of you said you've taken a test prep course with me, and I demo it there as well. It is a community, because if you create flashcards, they then go into the community sets. And if you're on, you get a chance to use those that are made by your fellow test takers. So I just checked before I went on the webinar, and I think on the master site, we have, it says 100 plus. So I don't even know how many there are, but there are literally hundreds of flashcard sets that are free, that are developed by other test takers that you can use yourself, in addition to the ones that come for the book. And then there are flashcard sets, obviously, that have been developed by the clinical test takers as well, and the bachelors. Great, thanks for answering. And the Springer folks will show you, you can access that using the digital 6-month product. Good, thanks, Scott. There are games. You don't get the flashcards on your phone. So some people are saying they don't have the flashcards. If you're studying off your phone, you need to be using a desktop, okay, or a tablet. The app version doesn't have the flashcards. And the other thing that I would say is, I'm not a big fan of studying on my phone. I know we have it, you know, so that you can do about it. EPC is 6-month access is free if you've purchased the book with the code, but otherwise you would need to purchase it. Okay, it's basically a whole test prep product. So there are games. These are different games that you can interact with the material. What I didn't put up there is that there's a game called Sudden Death. I don't like that name, but anyway, we have all kinds of fun things where you can interact and play different games so that you get familiar with the content and with the various questions. Oh yeah, I have it up there, Sudden Death at the upper right. So. As Lee said, some of you are asking specifically about different products and the cost. Because you're on the webinar, you can use the discount code on the Springer site for 25% off for products. And Lee, is that for digital as well as print products?
Yes.
Okay, so for those of you that are maybe already have a book, or are not interested in a print but want to use the EPC products and have access to the discussion boards or whatever, you who doesn't love a coupon, right? You have a discount code today that can be accessed using the website to get 6 months access to the product. Is there longer access than just 6 months? Anyone from Springer, or is it?
It's only 6 months access at this point.
I'm sorry, say it again?
Only 6 months of access at this point.
Okay. Who wants to study for more than 6 months anyway? So I'm hoping that'll spur people, right? Once you redeem that code, if you don't have a test date or a study, that'll get you going here, right? It'll motivate you. So, you can, I think you can extend, is that true? But there's a fee associated with that. Is that true, Scott?
I'm sorry, just say that one more time.
If somebody used their 6 months, but maybe they didn't test or they have to retest, can they purchase it again, or?
Yes, good. You'd purchase another 6 months at the, if you need.
And Dawn, in the chat, Lonnie mentioned that they just paid more to extend.
Okay, so, great.
Yeah,
so you can. Easy. Good. We hope you don't need to extend, right? But if you do, you can purchase it. So I know I've probably done a horrible job answering all those questions, but I want to answer them. So you don't understand. There's nothing that I like more than answering questions. So if I didn't answer your question, or Lee, maybe you could help me.
Sure. I mean, I think you answered most of the questions. The other thing is we will keep track of the questions and can follow up with folks after. In the Q&A, there were, let's just see here, there was one person asked, do you need to register for the exam one time? What if I register and I'm not ready to take the soonest offered exam? Does that depend upon states or? Okay, so the chances are when you
first, what happens is you have to get pre-approved by your state, and every state has a different process. Once you're pre-approved, then you need to, they will then tell you to go ahead and register with ASWB. As you saw, the fees are the same regardless. The bachelor's and master's is $230. The clinical and advanced generalist is $260. You're going to be paying every time you register. I mean, every time, not every time you read, every time you take the test. So hopefully it's just once. Generally, when you go to pick a test date, they're either really soon or they're really far, okay? If you've been studying, maybe you're ready for the really soon, okay? If not, you probably are gonna pick a date that's a little bit farther out. You are able to reschedule. You can find that information on the ASWB website. But there is a limit. You have a year to take the test from the time that you pay the $230 or $260. And there are some rescheduling fees. So you want to be familiar with those and make sure that you give, ample notice. But as long as you do that, you are able. But I just would warn against that, because generally when people are rescheduling, it's because they haven't put together a good study plan or their anxiety is getting the better of them. So sometimes I have people call me and I sort of talk them off the ledge here, but I would be a little bit careful, because once you get a date, you really need to develop your study, plan to that date. I see a couple things in the Q&A and the chat related to just strategies. And what I would say is that, this is a test of what you learned in your MSW or your BSW program. So unfortunately, I never talk disparagingly about other products or other things, but if things are being said that are not things that you would have learned, or anyone can write test prep resources. That's why, I went over a little bit about me. I'm a social worker. I am one of you. There are resources written by people who aren't social workers. So what I would just say to you is, you're smart. And so if it doesn't sound right, if it sounds like sort of a get rich quick gimmick or something like that, I would, I would stay away from that, because this is a, this is a standardized test. I approach it the same way as, I would prepare someone for the SATs or the GREs or, any other kind of standardized test. And so there's a reason that the book is, 400 pages. There's a reason it's serious, right? This is what we haven't mentioned is this is about consumer protection. I know it causes anxiety, but there's a reason that there is a test. And so you want to make sure that you're using a reputable product.
Dawn, a couple of people have asked about, they have the second editions, and they asked if they're okay to use those for prep for the test. As you've talked about, and we've mentioned in the chat, if people are interested in accessing Exam Prep Connect, they can do that separately and pay to do that. But regarding the second editions, is there any additional advice you would say to folks that have posted about that?
I mean, the third editions have been out for about a year. Right. I'm just, it's hard for me to say. I mean, there is material. I mean, sometimes people get, I know people are trying to conserve resources. There's lots of used copies and things like that. I mean, if you have a second edition and you want to purchase Exam Prep Connect, like the third edition, right, online or whatever, I would say that would be obviously totally fine, right? Because some people just use EPC. They don't even, have a print book, if you will. But there's lots of, I just went over all the features. So if you're looking at yourself and saying, wait a second, I don't have access to a discussion board. I don't have games. I'm not, what flashcards are you talking about? You may not have all the tools that, are available.
Yeah, fair. Fair enough.
right?
And
So,
just to remind everybody that you can, as the slide says here, you can enter the discount to get the 25% off. Suzanne asked, there was one more question that came up earlier. Suzanne asked about how do you feel about the acronyms FAIR, AFI?
yes, I'm familiar with those.
Yeah.
My last comment, and maybe you can, Suzanne, maybe you can, hopefully you listen to what I just said, right? I really, when I teach test prep, I mean, I work, with lots of people who have bought the books and Google me and, email me. I mean, that's really what I do, right? And so I would just say I've been teaching in social work education for 30 years. And so I help people and I use the same strategies that I use in my teaching. So if a strategy is being recommended that is not something that you would learn in an undergraduate or graduate program, there aren't any tricks here. So I guess I'll leave it at that.
Sounds good. Well, we're up at the end of the hour. So I think, Dawn, we will try and answer everybody else's questions that they send in now, but otherwise, I think we're in good shape. Thank you so much, Dawn, for your presentation today. Thank you everyone for attending. We really appreciate everybody's attending and staying with us for the hour. We will be sending out a recording of this webinar to everyone within the next week. Plus, we will send the information about the discounts for people. So thank you again for everybody attending, and thank you, Dawn.
Oh, can I just say one last word?
Yes,
I would just say,
please.
The reason that I do this, I mean, people are thanking in the chat, is you can pay it forward by helping other people, right, as licensed social workers. So you are and will be my colleagues. Some of you are students. And so, I want you to be licensed. I'm here for you. I know it's a stressful time. I look forward to having you as colleagues, and we need you, right? We need you as licensed social workers. So if in any way these products have helped you or will help you, you can pay it forward by helping others in the service that you do.
Excellent.
So thanks.
Thank you, and wishing everyone a wonderful rest of the day. Thank you.